Hello, I wanted to do another video today to talk to you about dermal fillers. I frequently get asked, are dermal fillers safe? So I thought a video would be the best way for me to explain a little bit about how dermal fillers work, what makes them safe or unsafe, and how those risks can be mitigated. So how do dermal fillers work? Well, typically dermal fillers are made with a substance called hyaluronic acid, which is cross-linked to make it stronger, to allow it to provide volumization and structure for areas of the face. So you can inject dermal fillers into the lips, along the jawline, the chin, lines going from the nose to the mouth, into the temples, and across the cheeks as well. So lots of different indications to provide different types of results depending on what your patient wants. So the range of consistency of dermal fillers also is quite different depending on where you're going to be injecting it. So you have more liquid fillers that are almost like injectable moisturizers, and you've got firmer, more gel-like consistency fillers that are almost trying to mimic the structure of bone, particularly along the jawline and along the cheek. So dermal fillers replace volume that we lose as we age. As we get older, we tend to lose fat deposits in our face, as well as some bone resorption, where bone is actually resorbed back into the body. So that leaves you with a very kind of gaunt look as you get older. And dermal fillers are a really good way to address this and to try and replace some of that volume that's lost. They can also improve skin quality because hyaluronic acid is hydrophilic, so it attracts water to it, which means that each molecule of hyaluronic acid can attract up to 1,000 molecules of water, which helps to clear up the dehydration and dryness that we tend to get as we get older as well. So what's involved in a dermal filler treatment? Well, typically you would have injections of the dermal filler using either a needle or a cannula. There are differences between those two methods. Namely, the needle will be able to pierce the skin and you inject everywhere that you want to place the dermal filler. The cannula works more underneath the surface of the skin. You use an introducer needle to create a small hole, a port, and then the cannula glides underneath the surface of the skin. It's blunt tipped, and it allows you to deposit again the areas of filler exactly where you want it. The main reason that I tend to choose cannula more than needle is because the cannula is blunt tipped and it's less likely, although not impossible, it's less likely to actually penetrate into a blood vessel. So that leads nicely on to the main risks of dermal filler treatment. Main risk, there are numerous small risks like bruising, which can be dependent on your technique, infection, which is dependent on the cleanliness of the skin and of the instruments or tools that you're using, and vascular occlusion, which is basically blockage of a blood vessel. That's the biggest risk and it carries the most penalty. So if you block a blood vessel with dermal filler that's gel-like in consistency, blood flow cannot go through that blood vessel. So the area of skin that that blood vessel serves will not get the blood, the nutrients, the oxygen, and that area of skin will die, which is called necrosis. So to avoid this, your practitioner needs to understand where the blood vessels are, where they're likely to rise closer to the surface, where they're likely to be deeper, and exactly what they're injecting into, whether they're using a needle or a cannula. So how do you mitigate those risks? As I said, with things like bruising and infection, it's really about technique and it's about the cleanliness of the field that you're working in. With occlusion, you have to be very careful. You've got to know exactly where the blood vessels are. You've got to know what you're injecting into. You've got to watch the skin for signs of occlusion because it will happen straight away, more or less. And you also have to be able to mitigate the risk if it does happen inadvertently. The main way we do that is by injecting a product called hyaluronidase, Hyalase for short, and that dissolves dermal fillers, but it does come with its own risks. So, for example, Hyalase can increase hypersensitivity, so you could have an anaphylactic reaction to it, which comes with its own problems like breathing issues, etc. So Hyalase is not something that should be used lightly, and it's not something that should be used because you just don't like the way the filler looks. You should have an in-depth consultation every time you have a dermal filler treatment with your practitioner, and you should be asking them questions that make sure that you understand what your expectations are, what the results are likely to be, what the dermal filler treatment is likely to do for you, what the risks are, and how your practitioner is going to mitigate those risks. So for example, ask them about their skill, about their knowledge, about their experience, their training. Ask them if they have access, easy access, fast access to emergency medication like Hyalase. Ask them which dermal filler product they're going to use and why. So ask them about the consistency of that product. Ask them why they're placing it in that particular area of the face. Ask them what they expect the results to be. Ask them, how do they recognize an adverse event like a vascular occlusion? Would they know it if it happened? And if they knew that it happened, what would they do next? How quickly would they react? How easy would it be for you to get hold of them? Once you've had your treatment and you've gone off, if you notice that something is wrong later, how easy would it be for you to get hold of your practitioner, and how quickly would they respond to you? How do they manage these issues? So you really need to leave that consultation really satisfied that your practitioner has given you good answers to all of those questions. And then you can go ahead and say, yes, I would like to have treatment with you. I hope this has helped you decide when you're trying to think about whether or not you want to have dermal filler treatment. If you have any other questions, then feel free to contact me on my socials. That's TD Aesthetics on Facebook and on Instagram, also on my YouTube channel, and via my website at www.tdaesthetics.com. Have a great day. Bye for now.